My journey to become an advocate for healthcare is really kind of crazy. I grew up in a small town in southern Missouri. It had a gas station, a bar, and about 5 stop signs. My mom was a full-time waitress, and my dad, he was a mechanic, and they both worked really hard and full-time for as long as they could. So at first, my dad had gotten sick, and then things just kind of progressed. Finally talked him into going to the hospital because he wouldn't want to go just on his own because he couldn't afford it. So my parents had too much in savings to qualify for Medicaid. They had saved up a little bit, but not a lot. And we're talking a few $1,000s. And without qualifying for Medicaid, we had to basically do what we could with what we had. They worked their whole life to then pay their taxes to get to where, they could retire essentially. In rural areas, the retirement plan is make it to 62 when you get your Social Security coming in, and then pray that you make it to 65 when Medicare kicks in. My mother was actually almost identical kind of story. Similar situation, she fell ill due to a similar set of complications. And then about 6 months later in July, we were forced to make those same kind of decisions. Are we going to be able to afford this managed care? Is that going to be possible? Are we going to be able to afford the doctor's bills? And then shortly she fell the rest of the way ill and passed away mid-July. So after my parents passed, I decided that I would do whatever it took to make sure that folks didn't have to deal with this.
Accessing healthcare in rural communities looks a lot different than it does in an urban or even suburban community. Namely, that is, accessing specialist care is really not a thing you can do within your own community. To see any kind of specialist, and often now is the case for emergency care, you're having to travel. That means getting on the interstate. It means driving often 30 minutes to an hour and a half even to get to that. So there's that physical distance. And then we also have high rates of uninsured folks because we haven't expanded Medicaid. We see people put with an impossible choice of you only have so many dollars, your prescription is so much money. Frequently we see people skipping doses, they're cutting pills in half and making things stretch because they need to keep the lights on. They've got to put food on the table. But we see people, unfortunately, when they are trying to cover these gaps of being uninsured, that's when things often happen, right? The emergency happens, the tractor tips over, the cow kicks you, you get in a car accident, all of these things that happen that are out of your control. And we know that not only not accessing healthcare services in an emergency situation like that, but even not accessing routine healthcare and preventative healthcare, going to the dentist, all of these things that you do when you have access to insurance and quality medical professionals, set you up for really drastic health outcomes in the long term. opposition we hear for Medicaid expansion is that we can't afford it, while 37 other states, including 6 of the 8 states that border us now with Oklahoma's vote, have expanded, is that we see that simply doesn't hold up. We see not only the improved health outcomes of folks in states that have expanded Medicaid already, we see the savings and actual generating revenue for their states and freeing up money that is used on things like education and public safety and infrastructure and all the things that we desperately need here.
You like to think that something like this would never happen, but unfortunately, it's a situation that's all too common. There's 45,000 people every year that pass away due to lack of access to healthcare, and that's 45,000 families that are forced to make these decisions. And that's 45,000 families whose entire lives are turned upside down. I never thought that I would be one of those people, and I wanted to make sure that we did whatever we could to make sure that would never happen. And when presented with the opportunity to do whatever you can, you just go out and you find the people to talk to, you find the conversations to have, and you find the actions to take to make sure you advance it. And if that's gathering signatures on a petition, if it's running for office when presented the opportunity, if it's just making sure to show up and vote, you got to do whatever's in front of you.